Honorable Regional Director Dr. Saya Piukala, Honorable Assistant Secretary of Health of the Philippines Dr. Gloria Baula, Honorable Governors of the Guimaras Province Maria Lucian Nava, distinguished partners, colleagues, ladies and gentlemen. I'm honored to welcome you to the Western Pacific Regional Commemoration of the World Diabetes Day 2025. Diabetes is a complex, non-communicable disease that is a serious public health problem. In the Western Pacific region, the number of people living with diabetes increased 4 times in the last 2 decades, and we are off track from the 2025 targets of halting the rise of the disease. This special day allows us to come together to understand the disease better and raise our voice to advocate for stronger prevention and control measures against the disease. The theme of WHO World Diabetes Day for 2025 is Diabetes Across Life Stage. It aims to highlight that the disease impacts all age groups, from children, women, working age adults, and aging population. Therefore, this disease must be addressed through a life course approach, an approach that is very much aligned to our priorities here in the WHO Western Pacific Regional Office. Today, we have prepared an interesting program for you to demonstrate what can be done to prevent and manage diabetes from the global down to the country level. But more importantly, at the level of individuals, people who are already living with the disease. Providing practical information to youth is also very important, which is why after the main ceremony, we invited speakers and experts who could help us to better understand the disease and its management. So I encourage you to listen and ask questions that could help you and your loved one to prevent diabetes and its complication. Thank you very much, Ardi, and all distinguished guests and everyone for joining us. And I wish the event a great success and a memorable one. Thank you so much, and back to you, Dr. Domingo.
Thank you, Dr. Wong. Thank you for joining us, even though you're overseas. At this point, we really would love to hear the message from the Western Pacific region, and I would like to call on, please welcome the Regional Director of the WHO Western Pacific Region, Dr. Saya Miao Piukala.
Honorable Maria Lucille Nava, the Governor of the Philippines, Guimaras Province. Dr. Maria Selina Caffin, Director of Disease Prevention and Control Bureau of the Philippines Department of Health. Dr. Maria Socorro Guinion, the Provincial Health Officer of Iloilo Province. Partners and experts from the Institute of Philanthropy, the Philippine College of Endocrinology, Diabetes and Metabolism, the Philippine Alliance of Patient Organization, the Humanity and Inclusion Organization, colleagues, ladies and gentlemen. Magandang umaga, and good morning to you all. Today, it is both an honor and a privilege to stand with you as we mark World Diabetes Day, a day that reminds us of the agency and the responsibility we share. This year's theme, Diabetes Across Life Stages, reminds us that this disease can touch anyone at any point in life. From childhood to older adulthood, diabetes demands care, compassion, and commitment. This occasion is not just timely, it is a strong reminder. Diabetes has become so common that we sometimes forget its silent, devastating power. From blindness, kidney failure, heart attacks, amputation, and yes, even death. None of us are strangers to this disease. Many of us have seen its impact on friends and loved ones, or perhaps we live with it ourselves. Diabetes does not discriminate. It can touch anyone, children, adolescents, working adults, and the elderly. Please allow me to share a moment that shaped my resolve. Years ago, during a visit to a small island hospital, I met a man in his early 50s, a fisherman, strong and proud. But diabetes had taken its toll. He had lost one leg to amputation and was facing the possibility of losing the other. But what struck me most was not his pain, but his question. Doctor, will I still be able to provide for my family? That question has stayed with me. It reminded me that diabetes is not just a medical condition. It is a human condition. It affects livelihood, dignity, and hope. In our Western Pacific region, home to 38 countries and areas, more than 220 million adults live with diabetes. That is 1 in 4 cases worldwide, the highest among all WHO regions. And yet, only half know that they have it. Even fewer receive the care that they need. The burden is heaviest in low and middle income countries and in our small island states. In the Federated States of Micronesia, 4 in 10 adults are estimated to have diabetes. In the Solomon Islands, 60% of surgical patients suffer severe diabetic foot wounds, many facing amputations or fatal infections. But here is the good news. Diabetes and its complications are preventable. We can change this story, but only if we work hard and work together. In 2021, the world united under the Global Diabetes Compact, followed by ambitious coverage targets in 2022. By 2030, we aim for 80% of people with diabetes diagnosed. 80% of those diagnosed are achieving good blood sugar control. 80% controlling blood pressure. And 60% of adults over 40 receiving statin and universal access to affordable insulin and self-monitoring for type 1 diabetes. These are not just numbers, they are lives. They are mothers, fathers, children, colleagues, people who deserve care and dignity. The Global Diabetes Compact, led by WHO, aims to improve access to essential medicine and devices for diabetic care, advocate and implement measures to prevent type 2 diabetes, and develop research agendas and technical tools to support our member states. Women with diabetes during pregnancy, to protect mothers and babies. And congratulations to the Philippines, the Healthy Hearts Plus, WHO Philippines Diabetes Technical Package to integrate diabetes care into primary health services. So across the Western Pacific, countries are stepping up. And soon we'll hear inspiring stories from Malaysia and Solomon Islands, proof that progress is possible when we unite. Let us never forget, people are at the core of our work. For children, care at home and school helps them grow and learn. Lives. For adults, supportive workplaces allow them to thrive. And for older persons, continued care preserves independence and quality of life. Today, I call on all of us, health agencies, providers, partners, non-profit organizations, and communities to join forces under the Global Diabetes Compact and our vision of weaving health for all. Let me leave you with this thought for those living with diabetes and those of us, Eric and the team, Yun Young, Liv and the team at the county office. Is resolved. And as the great Maya Angelou once said, do the best you can until you know better. Then when you know better, you do better. So on this World Diabetes Day, let us sharpen our resolve like never before, because the future depends on what we do today. So I wish all of you happy World Diabetes Day. Maraming salamat po. I thank you.
Thank you, RD. Thank you, RD. And I think as Dr. Piukala said, today is a very important day. We do have two products to launch, and one is global. It will help all of us manage women with gestational diabetes. And one is local. It will help every Filipino get access to diabetes care in primary care level. So for the first one, we have Bianca Hemmingsen from HQ. She heads the diabetes program at the headquarters to tell us about the first product. Bianca?
Hey. Thanks a lot, everyone. And thanks to Wipro and also you, Regional Director, for making these nice and compelling opening remarks. It's very difficult to come after you, I can say. It was really a touching opening you did. And thanks to Eric for celebrating World Diabetes Day here and for all of you coming to celebrate with us. My name is Bianca Hemmingsen, and I'm the medical officer working in Geneva headquarters on diabetes management. The program we have is the Global Diabetes Compact, and I will tell a bit more about it during this presentation. Can I get the next slide, please? Perfect. As mentioned in the opening remarks, diabetes is a global burden and it rises in all regions, and this region is not an exception, of course. In 1990, it was estimated around 200 million people have diabetes. The latest estimate said 800 million people globally live with diabetes. And more than half of these aged 30 years or more do not receive any treatment for the condition. And finally, we can see that most of the people not being treated, they come from low and middle income countries. Just to show the coverage and the prevalence by region, and you can see the Western Pacific or Wipro, it's not an extension. We see a rise. This is the prevalence estimate, so it's doubled or a bit more than doubled since 1990. And there we see the treatment coverage That's about 40.7% get treatment. It means that it's aligned with the global that 60% do not receive treatment for their diabetes. Next slide, please. In order to address this increasing burden of diabetes globally, the headquarters initiated, the World Health Organization, together with the regional offices, initiated the Global Diabetes Compact in 2021. This was super timely because just 1 month after, during the World Health Assembly, member states, they endorsed a diabetes resolution. And in that resolution, all member states, they committed to prioritize diabetes, integrated into NCD programs across the life stage. The year after, member states, they endorsed 5 global coverage targets, which was also mentioned in the opening remarks. But just to repeat them here, it said that by 2030, 80% of people with diabetes should be diagnosed. 80% of people with diagnosed diabetes should achieve good glycemic control, the same for blood pressure control, and 60% of people ages 40 years or more should receive statins. And finally, all people with type 1 diabetes should have access to affordable insulin and glucose self-monitoring. These targets, they are all very ambitious, but they are achievable. In order to facilitate the achievement of these targets, the Global Diabetes Compact works in 6 work streams. I will not go into details for these work streams, but just to mention, we work on access to medicine and technologies, technical products, prevention, country support, research, and governance. And I will just mention a few activities. Next slide. Just to show some of the technical products, and I'm sure several of you already know, some of them at least. Hopefully you're all familiar with the pen or have heard the word pen package before. This is a package for primary healthcare, and from this we have made one focusing on type 2 diabetes called the Heart-STI. Most recently, during the last year, we have made a report on availability of pricing of technologies for diabetes. We have made a product to help monitoring of diabetes. And finally, also integrating diabetes into tuberculosis and HIV service deliveries. Just to show example of the country support work stream, a lot of regions, they have committed to the Global Diabetes Compact. The first one was PAHO in 2021 that made a regional implementation plan for the Global Diabetes Compact. And most lately, we had Shero last year with their call to action. And these frameworks are like regional plans on how to improve diabetes care. Another example of the country support workstream. I'm sorry for having several slides on this, but to me, this is the most important workstream actually of the Global Diabetes Compact. Everything we do needs to go on the ground if it has to have an impact. So this is just an example of country support. In the Global Diabetes Compact, we have joined initiative together with the Afro colleagues and 2 country offices, Ghana and Uganda, where we have made joint fundraising, and then we have focused on integrating diabetes and hypertension, because they often go hand in hand, into primary healthcare system. We have adapted our guidelines and also promoted engagement of the community. And we see now, 2 years after, that there have been increased awareness around diabetes. There have been adaptation of several products. They're in the best buys, and also the surveillance system has been enhanced for diabetes and hypertension. This is the slide for the governance, or the 6th work stream, and it's just to show that in order to achieve the objectives of the Global Diabetes Compact, it cannot be done alone by the World Health Organization. It's really an all-hands-on-deck approach. And here are some of the stakeholders that we collaborate with. Of course, we engage with our regional offices and member states. We have a technical advisory group of experts on diabetes. We have 2 from each region, so we also have 2 from the Wipro region, of course. We have the Global Diabetes Compact Forum, which engage stakeholders and universities. And if there are any stakeholders around here today, please feel free to contact me if you want to be a part of this group. There we convene twice a year on a theme that is decided by the forum members. Last time it was on the UN high-level meeting. And we also have regular convenings of people living with diabetes. At the end of the day, we all want to help people living with diabetes to have a better life. So that's a very important engagement mechanism we have as well. And finally, engagement with the private sector. That is mainly to facilitate the work stream 1 on access to medicine, because we need commitments and buy-in from the private sector as well to achieve it. So just since we are celebrating today World Diabetes Day, I want briefly to mention, it has already been said, but I will say it again, that it's through life stages, because diabetes is not just one point in life, it's a continuum in life, and it can affect everyone at every stage in life. The main focus for this World Diabetes Day, or main technical products to come out, it's diabetes in pregnancy, and it is a huge problem. Most women, they get pregnant during their life, and it affects about 1 in 6 pregnancies, and it has effects both of the woman, the developing baby, as well as the child afterwards. For the woman, it can have immediate consequences for the pregnancy, like preeclampsia, but also long-term consequences with increased risk of diabetes. For the baby, there is increased risk of stillbirth and complications. And finally, the long-term risk for the babies is diabetes and cardiovascular disease. So investing in diabetes in pregnancy, it's investment in the future. So just to why we should prioritize these guidelines, and it might seem obvious, but we always have to think, is this really needed when we start some work? And there are really a lack of evidence-based recommendation on diabetes and pregnancy. We have never done it within the World Health Organization. And as I mentioned in the beginning, the major burden on diabetes, it's in low and middle income countries, and most guidelines, they are made for high income countries. So we need guidelines that are evidence-based and have a public health approach. So we will launch today. It will be 9 a.m. Geneva time, so it's about 4 at Manila time. We will launch the first ever recommendations on care for women with diabetes during pregnancy. And it's not only recommendations for GDM or gestational diabetes, it's also for women who have type 2 diabetes and type 1 diabetes during pregnancy. So I will not go into details, but just to show you, it's a very broad spectrum of management that we cover. It's both lifestyle advices, it's education, it's monitoring of glucose, it's pharmacological management, but also additional monitoring that might be needed, some fetal assessment and complication screening. So in order to stay connected, there are 3 different QR codes here. The one for our monthly newsletter that goes out. Through that newsletter, you can hear about technical products going out and different convenings, job openings, and whatever. We have it will also recap World Diabetes Day, including this event, of course. We have the forum, which convenes stakeholders. So please, if you're an NGO or a university or a patient association, please apply. And we have a web page with more information. So with this is my last word. So thanks a lot for your attention.
Yeah, thank you, Bianca. And to officially launch the WHO recommendations for care for women with diabetes during pregnancy, we'd like to ask our regional director, Dr. Piukala, on stage with Bianca and Degi from Maternal and Child Health. Please join us. Again, the recommendations and the guidelines will be available online at 3 p.m. Manila time, 9 a.m. Geneva time.
So, in a count of 3, we will unveil the beautiful 2, 1. Ooh.
Thank you very much. We will send you the QR code again later, so you'll be able to access the document. The second that we were going to launch today is, of course, our package from the Philippines. And I would like to call on Rahaj, to please take over the hosting job for now.
Thank you very much, Dr. Eric, and good morning once again, distinguished guests, colleagues, partners, and friends. Now, before we move forward, let me give you a quick glimpse of what the Healthy Hearts Program Plus is all about. HHP Plus brings together the best our primary healthcare system. And in just a moment, you'll hear how all of this comes together in one comprehensive package. So to give us her remarks and a brief introduction of the Healthy Hearts Program Plus, I would like to call on our acting WHO representative in the Philippines, Dr. Yun Yong Ko.
Good morning, everyone. It's a pleasure to be here today as we launch the Philippine Diabetes Technical Package under the Healthy Hearts Program Plus initiative. I would like to warmly welcome our colleagues from the Department of Health and our partners from provincial health authorities. And then we have particularly the presence of one of the health champion have you here. And then our partners from our Diabetes Alliance. And then we have a lot of powerful CSOs who are providing technical assistance and also work out together. And also that we have a presence from our regional office for the Western Pacific, and then all of us who are joining here today. Thank you very much. Non-communicable disease, especially diabetes and cardiovascular diseases, remain a major challenge for the Philippines. The Healthy Hearts Program Plus is designed to strengthen prevention, early detection, and management for these conditions at the primary care level. This initiative provides health workers, communities, and policymakers with very practical guides and toolkits. Today's launch is an important milestone. This technical package reflects a shared commitment to evidence-based and patient-centered approaches and underscores the importance of collaboration between national and local health authorities with international partners and our communities. WHO, we are proud to support this initiative and look forward to having very fruitful gains out of this program implementation. At this point, it is an honor to invite Director of Disease Prevention and Control Bureau on behalf of Secretary Herbosa from the Department of Health to make a brief remark. Secretary Herbosa's leadership has been very instrumental in the innovations of diabetic care and treatment approaches. Thank you very much.
Thank you, Dr. Onyong. Good morning, everyone, and maayong aga for my kababayans in Western Visayas. So I'm also from Western Visayas. So diabetes has long been a priority of the Department of Health and the DOH as the authority and leader in health ensures that no Filipino is left behind in accessing quality care. So improving diabetes control by 50% is not just a target. So it reflects our commitment to transform prevention, detection, and management, and making care accessible, sustainable, and effective for all. So leadership in health means creating systems that serve every Filipino, especially those underserved or at risk. So today's commemoration and the launch of the Philippine diabetes technical package marks an important step forward, showing what is possible when vision, evidence, and partnership come together. So the numbers on diabetes highlights both the scale of the problem and the opportunity for action. So in 2024, about 4.7 million adult Filipinos were living with diabetes, yet only around 600,000 are captured in our health system or in our reporting system. So this leaves 4 million Filipinos either managed in the private sector or not receiving adequate care. Most likely, they are not receiving the care. So these gaps are more than just statistics, so they point to millions at risk of complications, and they call for a coordinated system-wide response. So we are aware of this challenge. So addressing this challenge requires not only stronger services, but also better detection, follow-up, and access to care for every Filipino. Next slide, please. So the numbers we see are more than statistics. So they highlight the urgent need for action. They raise two critical questions that guide our strategy. So how do we close the gap for the millions living with diabetes who remain undiagnosed or untreated, ensuring that no Filipino is left behind? Actually, commonly, they do not know the status, whether they have diabetes or not. The second question would be, how do we make diabetes care a standard, accessible, and high-quality part of primary health care? So answering these questions require a system-wide approach, one that reaches every purok or barangay or every community. So it strengthens care delivery and ensures that interventions are equitable, effective, and sustainable. So these questions lead us to the strategies we are implementing, integrating diabetes care into primary health care, building on the successes of the Healthy Hearts program, and launching the Philippine Diabetes Technical Package. So together, these initiatives form a clear, coherent roadmap for improving diabetes outcomes nationwide. And I hope this is something that will be sustainable. So next slide, please. So to respond to these challenges, we are embedding diabetes care into routine primary health services. So we need to identify and remove barriers in diabetes management, ensure care is accessible, affordable, and consistent. So we are partnering with Iloilo and Guimaras to demonstrate measurable progress in integrating care within the PhilPen protocol, models that can be scaled up nationwide. So since 2021, the Healthy Hearts program has provided a strong foundation for the national non-communicable diseases care. So we have done this in partnership with WHO Philippines, and we are applying these lessons in Iloilo and Guimaras. So this collaboration demonstrates our commitment to comprehensive non-communicable disease care and to reducing premature mortality, ensuring that our health system delivers results where they are most needed. So the Philippine Diabetes Technical Package, the one that we will be launching today, localizes the WHO Hearts-D framework for our context. So it strengthens primary level diabetes care and aligns our health system with global best practices while adapting interventions for Filipino patients. So as part of the Philippine Diabetes Technical Package, anchored on health, Hearts D, we will develop lifestyle interventions to prevent diabetes complications through cost-effective behavior change. Then we will provide standardized tools and messaging to empower communities and health workers in promoting healthier living. So we will help our providers. Next is to ensure consistent and effective care. We will develop simplified screening cutoffs, including for the GIDA areas, to improve accessibility of diabetes services. So we want it simplified because we are aware that health workers are multitasked. So we really need to simplify things for them. So for this, we will provide streamlined clinical pathways and medication procurement support to ensure timely and effective patient management. Next would be to strengthen of updated guidance for diagnostics and procurement to enhance supply planning and readiness. Logistics management is one of the biggest challenges in the Department of Health. So to facilitate discussions to accelerate inclusion of insulin in the gamot package, so we have this gamot package from PhilHealth. So we will discuss, or we have ongoing discussions with PhilHealth to include insulin in the gamot package. So this will improve access for the insulin for type 1 and type 2 diabetes patients. And I would also like to inform you that PhilHealth now is really active and very helpful in So next, to guide more precise and patient-centered care, we will develop use of total risk scores to communicate CVD risk and guide treatment intensity. So we will provide integrated interventions that are patient-centered and outcome-driven. Next, to ensure continuity of quality of care, we will develop clear delineation of roles and referral pathways to keep patients engaged in care. So we will ensure what would be the roles of the community, the primary healthcare facilities, and our APEX facilities. So we will provide strengthened primary level management to decongest our to ensure accountability and continuous improvement. We will develop health system readiness assessments to identify gaps and areas requiring support. So we will ensure that our actions are harmonized. There will be no duplication. So we will provide integration of global diabetes compact indicators into our field health information system to track progress and measure impact. This is also one of the things that we really need to improve. We need to have our information system in place, to document and to have the evidence, or to ensure also that we know what are the gaps. Okay. So lastly, we would like to inform you that our vision is clear. Quality diabetes care for every Filipino are delivered through a strong evidence-driven health system. So today we take an important step forward with the launch of the Philippine Diabetes Technical Package. So may I now invite you to join us in unveiling this tool. So it is a symbol of what part
Thank you. Thank you very much, Director Garfin. Now, at this point, we would like to invite our Regional Director, Saya, WR Dr. Yun Yong, and also Director Celine Garfin. And we would also like to request Governor Lucille Nava of Guimaras and Dr. Socorro Quinyon from Iloilo to join on stage for the unveiling. So we now come to a significant milestone in today's program, which is the unveiling of the Philippines Diabetes Technical Package. Now, may we request everyone on stage to place their hands gently on the covering cloth? And everyone, please join me in the countdown. So we will unveil together in 3, 2, 1. So may we kindly request our honored guest to remain on stage as we proceed with the official photo taking. Now, we may call on our partners who have contributed significantly to the development of this technical package. I would like to invite our colleagues from PCDM, DOH Central and Regional colleagues, Humanity and Inclusion, PAPO, PADE, and colleagues from the WHO Country Office to join our honored guest on stage, please. And also from our colleagues, of course, from the Institute of Philanthropy. Partners from DOH Central and Regional Office. And also from the provinces, please. Everybody. All right. Thank you to all our partners for the strong show of commitment towards improving diabetes prevention and care in the Philippines. May we request everyone to please get seated.
Thank you, RD. Thank you for spending such precious time with us. I know you have another 2, maybe 3 countries to do the annual reflections with. At this point in time, we're going to see some videos. We have some messages from, we have a message of commitment from our provincial leaders who have been instrumental in advancing local action against NCDs. First of all, may we invite the Honorable Malia Lucille Nava, a partner in the medical practice, to deliver her message.
They say health is a fundamental right and not just a privilege. So to my fellow advocates of quality healthcare, to our very supportive partners from the World Health Organization, our Regional Director, Dr. Saya, and Dr. Unyong, and all our partners and esteemed officials of WHO, to the DOH family, in behalf of Dr. Secretary Herbosa, Dr. Garfin, to the representatives of the Iloilo Province, Dr. Quinyon, in behalf of our Governor, Governor Art Defensor, and to the dedicated men and women frontliners in the delivery of quality health services. Ladies and gentlemen, a wonderful afternoon or morning to all of you, and happy World Diabetes Day. It is with deep honor and privilege that I stand before you today and join you in commemorating this year's World Diabetes Day. Our presence today is a testament of our shared mission and our common goal, that is to ensure that every individual has equal rights to quality, accessible, affordable, responsive, and people-centered health services. As a physician myself, health has always been the heart of my developmental platform in the province of Guimaras. For one of the core principles of our agenda is responsive healthcare, from which all our efforts for efficient healthcare emanates. Being an island province, we have envisioned Guimaras to be a province independently capable of addressing the health needs of our people in the future. We have managed to steadily improve and advance our health facilities in the province, the landmark of which is the upgrading of our LGU hospital into a medical center, our main service provider in the province. All our initiatives are geared towards the fulfillment and the implementation of universal healthcare. Through our integrated healthcare programs, in collaboration with DOH, as well as the strong support from international agencies, especially WHO, we are gradually fulfilling and realizing our aim of quality healthcare for all. I am here today to reaffirm the commitment that I have pledged last August of this year for the Healthy Hearts program, and further reinforce my continued and firm commitment to the enhanced new initiative, which is the Healthy Hearts Plus program, which would give emphasis and attention to one of the leading causes of morbidity and mortality, the debilitating diabetes. This year's theme, Diabetes Across All Stages, all life stages, reminds us that diabetes is a pervasive public health challenge that affects every individual, every family, every community, and every generation. It encroaches in all walks of life, regardless of their circumstances. It has been a lifelong, lingering concern, but also one where early attention and early action, as well as collaborative partnerships, community support, and a strong and dependable healthcare system can truly change its course. In Guimaras, we recognize the gravity of the challenge. Basing on our provincial data, diabetes stands as the 6th leading cause of mortality across all ages from 2021 to 2024. A recent data on for the third quarter of this year, not much of the status has changed. These data are not just numbers. This represents actual lives, lives cut short by this disabling disease. But through the collective effort of our local government, the provincial and the municipal governments of Guimaras, the health offices, our passionate health workers, and our partner agencies, we are making steady progress. Our provincial and municipal health offices have implemented massive screening using the PhilPen tool, identified and diagnosed cases, procured essential medicines, and conducted robust information drives in order to address this serious concern. This dedication is reflected in our 2024 data, an inspiring 74 to 78% of the 20 to 60 years age bracket of identified adults with diabetes have already been provided with necessary medications. This achievement is a measure of our commitment to responsive healthcare. The greatest honor that we are proud to receive today is the trust placed on our province as one of the 2 pilot demonstration sites for the Healthy Hearts Plus program. With our existing initiatives on the prevention of non-communicable diseases, especially hypertension and diabetes, we willingly accept this opportunity with full commitment and enthusiasm to strongly fight the onslaught of diabetes in our society. For our goal is to reduce premature deaths as well as improve the quality of life of individuals living with chronic diseases. This is a testament to what local, national, and international collaboration can achieve together. By integrating, standardizing, and sustaining hypertension and diabetes care in the primary level, we are strengthening the very foundation of universal healthcare. And we are establishing that even in a small island province like Guimaras, we can lead the way and open the path toward responsive health system under the UHC framework. What we will be launching today, the primary care diabetes technical package, aims to help provinces establish sustainable data-driven response to non-communicable diseases, which strongly also aligns with our province practice in promoting data-driven governance. And we are hopeful that this noble initiative will eventually address the challenges we face in our fight against diabetes. Today, I affirm the commitment of the province of Guimaras on the full implementation of this program in order to turn the tide against non-communicable diseases. We firmly commit to raise awareness on these alarming diseases, focus on early detection and diagnosis, and provide proper and adequate treatment to the best of our capacity. We would as well promote healthy lifestyle and strengthen effective information drive so that we can ensure that every person living with diabetes receives continuous quality care and compassion. We may not be able to fulfill this on our own, for there will always be challenges and limitations to what we can provide. But with the help of our partner agencies, I am confident that we could surf the waves together and navigate our way through this challenging course in our fight against diabetes. To all our partners in health, let us keep working hand in hand and sustain the gains that we have already made across every individual in all life stages and across every heart that we serve. Let us embark on a common goal and an ultimate goal, that is to build a future where everyone enjoys the dignity and security of a healthy life. From the people of Guimaras, thank you so much and mabuhay.
Thank you very much for that inspiring message of commitment, Governor Nava. Now we call on Dr. Maria Socorro Quignon, representing Honorable Arthur Defensor Jr., from the Provincial Government of Iloilo.
Sorry. Warmest greetings to everyone from Iloilo Province. I am deeply honored to deliver the message on behalf of our Governor, Arthur R. Defensor Jr., and the entire community of the province of Iloilo, Philippines. Health is a fundamental human right and a legacy of strength passed down from generation to generation. Today, we celebrate our shared commitment of safeguarding the rights of our people and empowering every Filipino family. In the province of Iloilo, we are leading the charge against non-communicable diseases through our pioneering initiatives, including the expansion of the Healthy Hearts Program. In partnership with the World Health Organization, we are transforming disease prevention and care at the grassroots level. With that, we take the opportunity to express our sincerest appreciation and gratitude to the World Health Organization and the Department of Health for bringing the Healthy Hearts Program to our province. This program continues to make a lasting impact, by the way, by covering the accessible and quality hypertensive services are available, especially within the primary healthcare. So in 2022, the province of Iloilo made history when it achieved an 85% blood pressure control, the highest globally. hypertension community. As we implemented the Healthy Hearts program, we also hoped to extend its life-saving benefits to persons living with diabetes. Once again, this aspiration was realized when the World Health Organization and the Department of Health selected Iloilo as an implementation site for the Healthy Hearts Plus program. Diabetes continues one of the leading non-communicable disease in our province and ranking 8th as the leading cause of mortality. Despite the continuous efforts of the Department of Health and the Iloilo provincial government, and affordable diabetes care. For fiscal year 2024, the total LGU budget amounts to 5.13 billion, with 2.17 billion or 42% allocated for health. Of this, 5.94 billion or 89.5% goes to hospitals, while only 226.7 million or 10.5% supports the public health. Nevertheless, despite the limited resources, the Iloilo Provincial Health Office remains steadfast in ensuring that remote communities in the province. To further demonstrate our commitment to strengthening diabetes prevention and control, we recently established the Provincial Diabetes Technical Working Group that brings together our local diabetes stakeholders to design and implement interventions responsive to the needs of our communities. One of the TWG's most significant milestone is the development of the IEC materials and instructional guides for children with type 1 diabetes, co-created with the children themselves and their caregivers. Our diabetes program in Iloilo may still be a work in progress and far from the ideal envisioned by the World Health Organization. But with the commitment of the Iloilo provincial government through the support of our beloved governor, the legislative, the support and guidance from the World Health Organization and the Department of Health and our development partners, we are confident that our diabetes and hypertension programs will continue to make a meaningful and lasting difference in the lives of the Ilonggos. Our partnership with the WHO goes beyond programs. It embodies a shared vision of universal health coverage, where every Ilonggo has access to basic medical services. This reminds us that when global expertise combines with local action, we are building a shield of prevention and protection in the community. As we commemorate the World Diabetes Day, let us walk together towards a diabetes-free future where every Filipino is active, healthy, and empowered. Because in the spirit of Bagong Pilipinas, we firmly believe that bawat buhay ay mahalaga or life is precious. Maraming salamat. Good morning.
Madam Ugid nga salamat, Dr. Quinyon. Now, at this point, we take a moment to acknowledge the partners and contributors who have made today's milestone possible. We recognize PCEDM, Diabetes Philippines, Humanity and Inclusion, PAPO, PADE, and PADSense, and IOP. To all our colleagues from the government, development partners, professional societies, civil societies, and communities, thank you for your unwavering support. Today's progress reflects the strength of our collective work. Maraming salamat po.
Thank you, Raj. And just to remind everybody, we're celebrating World Diabetes Day, the whole region today. And we do have messages from the Secretary of Health of FSM, the Federated States of Micronesia, which we're going to see in a few seconds. We also have a message from the governor of Kanagawa Prefecture in Japan. And we have some videos for you showing the work that we're doing in Malaysia and Solomon Islands. Please enjoy.
I'm Marcus Samo. I'm the Secretary of Health and Social Affairs for the Federated States of Micronesia.
While we are waiting for that to come on, we'd like to thank, of course, everybody who's helped us. The team from the Regional Medical Service are here, Dr. Marcia.
Samo, I'm the Secretary of Health and Social Affairs.
You pause muna, Sai, please. We'd like to thank the Regional Office Communications team. Have been working so hard for the last 2 weeks. The Philippine Country Office team, of course, have been here. Always welcome at the WHO WIPRO and everybody else. Now, Sai, please.
I'm Marcus Samo. I'm the Secretary of Health and Social Affairs for the Federated States of Micronesia. Diabetes is real, as you all know, no matter where you're in society, in communities. Our people are affected as early in life as 35 or 30, even late 20s. We're seeing an increase, not just for the elderly, but also the younger population. They're beginning to realize or getting amputations, complications of diabetes, and therefore affecting their ability to be productive members of society. And that is a worry for many of us. We're addressing or responding to this crisis from many angles, many fronts. An individual or society community must be aware of the importance of taking a responsibility for your action, how you behave, what do you eat, and staying healthy. We're also making sure that we make the essential medicines available to control the complications. Tobacco, for example, we need to figure out a way to make it not accessible to the younger population. Vaping is and even our own things like bitter nut chewing. All these contribute to the rise in NCD or diabetes. To be effective in what we do in response, it takes more than just health. It has to be environment, it has to be education, it has to be the transportation system, it has to be the traditional leadership system, the religious community, the entire government or society. We continue to work with the education sector, church, even just public awareness all over the place, in any medium, any outlet as possible. Church, wherever there's function, our public health teams are quite good in reaching other communities and increase awareness and public education.
Hello everyone, I'm Yuji Kuroiwa, Governor of Kanagawa Prefecture, Japan. I am grateful for this opportunity to share a brief outline of our Healthcare New Frontier policy on World Diabetes Day. As Kanagawa is facing a super aged society, we advocate a new health concept called Mibyo. Mibyo is a transitional state between health and sickness, which allows us to regard health as a spectrum. To improve our state of health or to manage Mibyo, 3 factors are essential: healthy diet, exercise, and social activities. In order to realize healthy longevity, as well as to create new industries and markets, we promote Healthcare New Frontier policy, combining the Mibyo concept with advanced technologies such as regenerative medicine, robotics, and AI. We are also working to evaluate the outcomes of these initiatives. We developed Mibyo Index in collaboration with the universities of Tokyo and the WHO. This is a smartphone application that can show an individual's current Mibyo status with a function of future prediction. Now, based on the Mibyo concept, Kanagawa Prefecture has been promoting measures against diabetes over the years. We collaborate with municipalities and medical associations to provide care for individuals identified through health checkups as being at a high risk of developing severe complications. As a result of these long-term efforts, the number of new dialysis patients due to diabetes in Kanagawa has been dramatically decreasing. I hope to create such good practices in Kanagawa and share them globally to promote health and well-being through management Mibyo. Thank you very much.
This program really helped us. Okay, not only me, my friends, I met them during the programs, past 3 months. Really helped us.
Penyakit kronik merupakan beban yang signifikan kepada negara. Hasil kajian melaporkan setiap 5 orang rakyat Malaysia, seorang akan menghidap penyakit diabetes. Penyakit-penyakit tersebut apabila tidak terkawal boleh menyebabkan pelbagai komplikasi kesihatan dan seterusnya meningkatkan kos rawatan. Cabaran utama adalah untuk mengubah persepsi pesakit untuk mengamalkan gaya hidup yang lebih sihat. Dalam perkhidmatan perubatan gaya hidup ini, kami mendorong dalam pencegahan dan rawatan berdasarkan bukti evidence-based melalui 6 komponen utama. Pertama, pemakanan. Kedua, aktiviti fizikal. Ketiga, pengurusan tekanan. Keempat, tidur. Kelima, hubungan sosial. Dan keenam, pengambilan alkohol secara sederhana dan mengelakkan dari merokok.
Program ini telah membantu saya lah, sebenarnya bantu saya banyak-banyak. Sebelum program ini, paras gula saya terlalu tinggi. Selepas mengikut program ini, saya dah disiplinkan diri saya. Cara pemakanan, kesenaman, semua dah berubah dah. Okay, tempat kerja biasa saya ambil lift, sekarang tak ada, saya pakai tangga. Okay, dan of course kita merokok, tak minum. Tapi macam minuman manisan semua saya tak ambil lagi dah. Keluarga saya makan, so isteri saya, mak saya dengan anak saya pun ikut saya juga. So it's considered a family kind of things lah. Yeah.
Dalam program Lifestyle Medicine ini, beberapa disiplin dan anggota kesihatan telah terlibat. Kami terdiri daripada pegawai dietetik, ahli fisioterapi, doktor, pegawai psikologi, jurupulih perubatan cara kerja, jururawat dan pegawai kerja sosial perubatan. Seterusnya, membantu mereka bebas daripada kebergantungan kepada ubat-ubatan dan insulin.
Terdapat sesi berkumpulan interaktif di mana pelbagai aktiviti diadakan dan perkongsian terbuka antara peserta berfungsi sebagai motivasi antara satu sama lain.
Bila saya dapati bahawa kita ada rakan-rakan sebaya ataupun ada antara kalangan kami yang mempunyai masalah yang sama dengan saya rasa lebih tidak terasa tertekan sangat dalam setiap program sebab kami boleh berjumpa dengan rakan-rakan dan boleh bertukar-tukar pandangan lah.
Terdapat juga sokongan maya yang disediakan di mana peserta boleh bertanyakan sebarang soalan dan semua maklumat dan segala tarikh temujanji dikongsikan dalam talian maya.
Sokongan melalui text message tu sangat banyak membantulah bagi saya. Apa yang saya tak pasti, saya ambil gambar, saya send. Lepas tu nutrition kita akan berkata, okey kalau sayur tu lebihkan sikit atau ikan tu atau ayam tu protein kurangkan lagi.
Peserta juga diajar teknik perubahan tingkah laku untuk memastikan aplikasi yang betul terhadap apa yang telah dipelajari dalam program.
Program ni faedahnya memang bagus untuk saya dari segi cara makan, cara saya minum, cara saya bersenam. Kalau dulu makannya saya boleh hentam apa saja, sekarang ni saya dah tahu cara makan yang betul.
Dari segi pemakanan yang sihat, suku separuh. Sebelum ni kita dengar kan, ini saya dah tahu dan saya amalkan benda itu. Saya dapat memahami asas-asas senaman yang baik untuk kami sebagai pesakit diabetes. Saya akan syorkan kepada rakan-rakan yang lain lah yang mempunyai nasib yang sama, mempunyai penyakit yang sama, diabetes.
Selepas menjalani program selama 3 bulan, saya mendapati bahawa pesakit lebih faham tentang gaya hidup sihat, apa yang perlu diamalkan dan bagaimana ianya boleh diamalkan.
Kami akan sama-sama berganding bahu untuk membantu pesakit ke arah kawalan penyakit kencing manis yang lebih baik.
In 2011, Solomon Islands declared NCD a national crisis. Diabetes is a major health burden contributing to significant social and economic challenges.
Over the last few years, I've seen the number of diabetic foot infections increasing for it to occupy up to 60% of the surgical beds in the hospital.
Health workers training is done everywhere, but unfortunately, it's common for health workers to return to work without changing their practice or adopting new standards. A national baseline assessment in 2024 found that of all diabetes cases, 8% were managed correctly. For preventative diabetic foot screening, 11% were managed according to national standards. This program targets this crisis with a strategic approach, beginning with coaching.
Coaching have no involve PowerPoint presentation or handouts. So I'm asking question, if I answer, and so I'm more involved inside. So time if I go back, so I'm not needing book for it, but also I'm still thinking long pana.
Coaching key practice skills was just the beginning. Even as knowledge and skills improved, several barriers at the clinic level made it difficult to apply the standards consistently. This is where quality improvement was introduced. To improve diabetes and diabetic foot screening and management, clinics made 6 key changes, decluttered and reorganized, creating more functional space. Everyone over 40 is now screened. Clinical production line. Tasks are split across stations, allowing 6 staff to care for 6 patients simultaneously. Foot screening is now routine for all diabetes clients for early detection and management of risk factors. Updated NCD registry book to align with national standards. Follow-up system, a tracking system to contact clients for their follow-up to enable a timely return.
Quality improvement, hembara help motor necessary for
Save do my work properly. So tayo mo tab karen bisala ownership for this program ne or the necessity or actively participate for sorting out own areas block eta.
Indicators such as the number of patients seen and diagnosed have improved drastically. People diagnosed with diabetes nearly quadrupled and diabetes management vastly improved. Diabetic foot screening was also introduced in health clinics for the first time for people with diabetes.
This time, something improve. So me feel happy everything you doing. So some patient am satisfied too.
If we can stop this epidemic of amputations that is plaguing this country, we have done something that deserves, it is a miracle what we have done. And you all are part of a miracle.
This model will be replicated to other clinics, and I'm sure this strategy will continue to save life and promote the definition of health as per the WHO definition.
The program is now expanding with plans to reach the entire country, coaching more health workers and improving care nationwide.
I must sincerely acknowledge WHO to put my health workforce as a champion of preventing physical disability.
This progress was made possible through the generous support and contribution of our partners.
Thank you. I hope you enjoyed that. So that is some of the work we're doing on diabetes here in the Western Pacific region. There's a wide variety. Every country, what is in their context, what works is something that we're supporting. And we hope that you continue supporting the work here in the Philippines. So to cap off this session, this part of the session, we actually have a person living with diabetes online. Please, Sai, can you connect? To give some reflections. And this is no other than our Director for Health Services here, Health Systems here at WIPRO, Mr. Luis Vinas. You there?
Buenas tardes.
Muy buenas.
Thank you, Eric. I've been asked a bit to share my personal experience, and they gave, let me put, I want to be disciplined, 5 and 7 minutes, and I should not talk about how to tackle diabetes as part of the primary healthcare and health system. So I'm going to focus about my personal experience. Let me start first a bit when I was diagnostic and what was my reaction. That was I had no symptoms at all. And I've not even had a worry that I could be diabetic. But then, as part of the regular checkups, my sugar in blood was high, but it was high at limit, no? And I say, okay, not a problem. I can go, no change of anything, just going ahead. But then, this was never going out on the subsequent checkups, no? And then it started to really reach the level of start being worried. And when I was presenting the results to the doctor, says, oh, you have to be careful, you have to shift to diet. And they will say, you have to recommend, you have to do exercise. And then say, look, I do exercise, I play football, and I run half marathon, so I cannot do more exercise than that. And then it reached a point that, okay, I have to put some action here. And then the action, I start with first denial. No, it will go. With my level of exercise, this will be handled. But then that it will not be enough. It's necessary to start thinking about the diet. And then I start with the easy things, like removing sugar from coffee. I used to drink coffee, and I drink quite a lot of coffee, always with sugar. Of course, I don't drink Cokes and these drinks, so no, there's little to do that. I reduce the sweets, sweets for desserts and these kind of things. And then I tried the diet way. And so I was doing a lot of sports and diet, but the sugar was not going out. And then, of course, I was gathering information, and of course there is sugar in many things that we eat. And my wife is Italian, which translates into eating pasta at least 4 times a week. And I love bread. In Spain, we eat bread. So, and all that has sugar, and the fruits that I like have sugar, and the beer that I might be drinking have sugar. So the problem I realize that the question to me is, I'm ready to sacrifice the things that I like to eat or that I'm used to eat. And then I'll go to an endocrinologist first in Spain, and then one in the Philippines. That started 4 years ago. And then basically said, there is no way that you can handle that without medication. And then since then, every single day I'm taking metformin with another drug combined. Then, but then I realized that I'm going to be diabetic for the rest of my life. And then comes to me when I was in Africa, and there was a lot of HIV growing, in the late of the 90s, and there was a lot of a stigma against HIV, and people living with HIV. And then I remember myself saying, why we should get such a big stigma for HIV? We don't have the same stigma for diabetes, no? And then made me reflect, okay, what would that imply for me? Can I come to terms with myself as a chronic patient already at my age? And then I start looking for questions why I am diabetic, and then I started asking family medical information, and then my father said, yes, I also developed diabetes when I was old, and my mother, also a bit older than my father, also developed diabetes. And then I start putting all the pieces together. And then also for the stigma part, I said, look, normally when the doctor sees me, says, are you diabetic? But you don't, basically this is a kind of an assumption that you are a bit overweight, or you are not doing exercise, or you are kind of a profile, and well, I think that I perhaps do not fit perfectly to this profile of diabetic. And that's probably one of the two messages that I want to pass here to you, that we should not or we should encourage everyone to screen and not to have preconceptions of what a diabetic looks like. I don't know if as I said, I don't think that I fit the profile of the perceived profile of a diabetic, but here I am. And I think that's a message, a strong message that there is no one that is out just because of the look or because of the preventive things that he might be taking, or the diet. So it's important that all of us consider the potential diabetic and keep a good eye on early detection. The second and last message is one reflection I wanted to make is, if we look at when we are happy at WHO, what we do. We eat, in Wipro. We eat and we sing karaoke, but let's focus on eating. And what we eat, we like to have a lot of sweets to share with our colleagues, and there's always Coca-Colas and drinks around the tables in our offices and when we do gatherings. But the culture of offering chocolates, for example, it's quite anti-diabetics and anti-healthy lifestyle. And I know that a few years ago in WHO headquarters, they started to shift to more healthy options when there is meetings, but also when we are celebrating, we are coming back from a trip and we bring pasalubong, right? So a reflection probably to maybe Eric and Dr. Huang and to bring to top management is, how can we change a bit of culture, or let's say, can we have pasalubong diabetic friendly? And with these couple of messages, I give back the floor to you, and thank you, Eric and Mitch and the team for this opportunity and for celebrating and raising awareness on diabetes. Over to you.
Thank you very much. Muchas gracias, Luis. Okay, so no more unhealthy to a healthy light meal, diabetic friendly. We have food outside. Please get something and then come back inside and we'll share the meal here in the room, and we're going to have an informal conversation on diabetes. But thank you very much, and please have a good rest of the day.